When it's time to apply for aged care, you'll need the help of an aged care assessment team to receive the services you or your loved ones need. Let's go through who these teams are, what they do, and how you can get an appointment with them. Aged care assessment teams are health professionals, doctors, nurses, and social workers. They work with you to find the level of care needed if you or your loved ones can't manage daily tasks in their own home. All Australian states use the same structure of assessment apart from Victoria. Their team's called the Aged Care Assessment Service. After they've independently and thoroughly assessed what support is needed, they help access services which suit your long-term needs. These teams are fully funded by the federal government and assessments are free. When you're ready to get in touch, the program covers all of Australia with teams based in hospitals and local community organisations. This includes the local GP, district nurse, health and hospital professional, or community aged support service may be able to refer you to your local assessment team. This information is also available on the internet. You can find a team close to you by heading to the My Aged Care website at myagedcare.gov.au. If you're applying for assistance, an assessment like this is mandatory to gain government funding for residential aged care, home care packages, transitional care and certain respite services. If you're paying for private care, you don't need an assessment. But either way, it's a detailed way of finding out what can help make life easier for yourself or your loved one. So how does it work? First, call and make an appointment or get a referral from a health professional. Then an assessment team will visit you or your family member at home or in the hospital to figure out what types of services you need. Depending on where you live, there may be a short waiting time between your call and the appointment. Second, the team will determine whether you're eligible for government assistance. If you are, they'll give you information on suitable care options and help arrange access, as well as give referrals to providers of residential care or home care packages. Third, the team will ask your permission to start the assessment. This is important because they may need to speak to the GP or other specialists to discuss the medical condition. They can only do this with your permission. They'll ask about any health conditions, how they affect daily life, and what assistance you think may be needed to help manage the daily tasks of living at home. They're here to help, so this is an open discussion about finding out what services best work for your family. You need to know all the options available to you in your area. Once you have all this information and you want to apply for these services, you'll then sign an aged care client record or application form that the team will provide you with. Lastly, after the assessment, you'll receive a letter telling you whether or not you're eligible for government funding services. This will say what services are approved and the reasons why. If you're unhappy with the outcome, you can appeal by raising your concern with the assessment team. Then, if you can't come to an agreement, you can bring your concerns to the relevant state government or territory. Your letter will have all the relevant appeals information on it, so refer to this or our website for more information. In the next video, we'll talk about the other advisors to contact and the reasons why you should consider getting in touch.